Dear students, welcome back. Yes, now we are going to see the other two scapular motions. That one is the elevation, depression, and protraction and the retraction. So, in the elevation and depression, the scapular elevation and depression can be isolated by shrugging of the shoulder up and depressing the shoulder downwards. Okay, and elevation and depression of the scapula on the thorax. So elevation and depression of the scapula on the thorax is commonly described as translatory motions in which the scapula is moving upwards, that is cephalad, or downwards, that is caudally, where on the rib cage from its resting position the scapula is moving upward and downward from its resting position along the rib cage. Okay, and the scapular elevation, however, occurs. So, as we know that because of the linkages of the scapula with that of the clavicle, so these scapular movements cannot be isolated. For that reason, so whenever scapular elevation occurs, there may be some elevation of the clavicle at the sternoclavicular joint. So elevation of the clavicle at the sternoclavicular joint, and also because of this elevation of the clavicle at the sternoclavicular joint causes some adjustments at the AC joint, acromioclavicular joint motions. So here at this anterior and posterior tilting of the scapula at the acromioclavicular joint, and also some internal and external rotation at the acromioclavicular joint occurs in order to keep the scapula in contact with the thorax. So because of this thing, so we are observing that it is moving only upwards and downwards from its resting position, causes elevation and depression of the scapula. But simultaneously, to cause this motion, some movements or some motions which are occurring at these two joint levels, or clavicular elevation at the sternoclavicular joint, causes some internal and external rotation, as well as the anterior tilting and posterior tilting of the scapula occurs at the acromioclavicular joint to maintain contact with the rib cage is occurring. Whatever these movements occur in here at this joint, that movements can be shown only on the scapula itself. So if you told that some motions or movements are taking at the acromioclavicular joint, like rotations are taking place, that means that rotations are causing on the clavicle itself. So inside the joint, that is arthrokinematics, inside the joint some medial and lateral translations, such movements are taking place. But if they explained as it anterior and posterior tilting, or external and internal rotation, so those rotations can be observed only the movements caused on the scapula. Okay, so this is about the scapular motion of elevation and depression. Now coming to the protraction and retraction. So this protraction and retraction of the scapula on the thorax are oftenly described as the translatory motion of the scapula, which moves away from the which moves away from the vertebral column, or towards the vertebral column. So protraction means away from the vertebral column, retraction towards the vertebral column. Okay. This protraction and retraction are also theoretically it is termed as scapular abduction and scapular adduction. So scapular abduction and scapular adduction. Scapular abduction means protraction, adduction means scapular adduction means retraction. Okay. So if protraction or abduction of the scapula on the thorax or occurred as a pure translatory movement, the scapula would directly move away from the vertebral column. So during this process, what will happen? The glenoid fossa would face laterally. So, and only the vertebral border, that means this vertebral border. So this is the superior view. So this point is the vertebral border here now. So only the vertebral border of the scapula would be in contact with the rib cage. Okay. So this point of vertebral border of the scapula is the only point is in contact with abduction of the scapula. So that means during protraction, here you can see this. So the scapula is rotating on the thoracic cage, and almost all this part is moving away from the rib cage, but only the vertebral border is the only point is come into contact with this thorax during protraction, that is pure protraction. In reality, full scapular protraction results in, if you see this, so the thoracic cage is normally in the arch form. So here the scapula is present. The scapula will move. So this is called abduction, shoulder abduction. It will, because of the clavicle also causing some protraction, which causes protraction in the clavicle, scapula. So it will move like this. So in pure translatory motion of the scapula, once the scapula moves like this, the glenoid cavity is facing laterally. But in reality, what is happening? The scapula is attached to the clavicle here. So the scapula will move somewhat away from the vertebral column and also somewhat anteriorly. So due to this reason, what will happen? The glenoid fossa is facing anteriorly during protraction. So in reality, this is the thing taking place, and also anteriorly, and the contact of the vertebral border is maintained during this motion also. Only the vertebral border of the scapula is in contact. Okay. The scapula protracts and retracts through the sternoclavicular joint protraction and retraction. So what happens during retraction? Again, this retraction of the clavicle at the sternoclavicular joint takes place, and also the scapula is coming to its normal position, and also in retraction means, so from resting position also it is moving towards the vertebral column. Okay, so this is taking place. So the scapula protracts and retracts through the sternoclavicular joint, protraction and retraction, and follows the contour of the ribs, by rotating internally and externally at the acromioclavicular joint. Okay, these are the scapular motions of elevation and depression and protraction and retraction. Okay, next, the internal and external rotations and anterior and posterior tilting are also taking place in these motions, that we will see in the next video. Thank you.